So, Dr. Nazeer, thank you for joining me today.
Thank you for having me. Excited.
Yeah, first Wonderland conference.
Yes.
Hopefully the first of many.
Yes, it's been a while. Everybody finally together. It's just awesome. It's like an anchor point, for the industry after so long of virtual. So it's awesome.
So long virtual, absolutely.
Yeah.
And now in the flesh.
Yeah, so many companies made virtually, pretty much,
So tell us about what you're working on with Wesana.
Yeah, so, I was just acquired. I'm a psychiatrist. I had 2 practices, psychiatry-based ketamine practices. The first in Chicago, 5 years ago. I opened that APS Ketamine, and we just were acquired by Wesana about a month ago. So
Because they were looking for entities that were already set up in ketamine-assisted psychotherapy?
Yeah, entities that weren't just purely a ketamine clinic. They wanted an entity that was more comprehensive and integrative, so meaning that we can handle multiple services for a patient, give them what they need. So if you come in, you might get ketamine, but we have Spravato, TMS, therapy, psychiatry medicines. So it was the right model of care for them. And it's a good starting point for us to start building a clinical infrastructure nationally. So I think it was a good fit.
Did you have a rapport with Wasana before they reached out initially?
So actually, I was in talks with Psychiatric, events company, a networking company in psychedelic space. We were close to finishing our acquisition when I started already working with them in a way as CMO role. And that's when Daniel and Wesana came into the picture, and we all hit it off. So they pretty much acquired all of it at once, my practices and Psychiatric.
Okay, so you are first and foremost a psychiatrist.
Yes, addiction psychiatrist.
Addiction psychiatrist specifically. So you were prescribing medication for people who were dealing with addiction.
Yes, in my prior stint before this, I was also chief medical officer of an addiction treatment program nationally. So they had 12 locations, Symmetria Recovery. So I was focused on addiction, but I'm also focused a lot on treatment refractory conditions, which is what psychedelics and ketamine help so well. So I wasn't only doing addiction. I kind of like just one of the parts of that's my board subspecialty, but really it's general psychiatry and focused on treatment refractory conditions. People who've tried a lot of treatments and have not gotten better.
Could you explain the term refractory condition?
There's a definition that's very technical for it. You failed 2 medicines, you're considered treatment refractory. However, to be honest, people they've tried ECT, electroconvulsive therapy, they've tried general psychotherapy, they've tried multiple meds. They're all treatment refractory. People who aren't responding to traditional approaches, basically. That's who, a lot of times, that's the MO of somebody coming to us, into our clinic.
Yes.
Which is important to us because our approach to psychedelics and ketamine is one for mainstream medicalization in a way.
And when you say mainstream, are you referring to it being a first option treatment as opposed to coming to later in the process of searching for a solution?
Promoting access to care, right? So trying to get insurance companies to reimburse, having people come to us under the framework of I'm just going to see a doctor in a clinic, right? Like a psychiatrist or somebody they're coming to see. But when they get there, now we have all these new therapies that we can put them in. So it's about making it digestible for
Sure.
If I ask my mom and dad, do you want to come with me? Let's say I want to get you on a retreat somewhere for a psychedelic experience. They might not, be keen on doing that. Or some people they trust the medical system.
Right.
So we want to make sure we're going to push insurance coverage, make it affordable in our framework, but make sure we stand out in not just a typical visit. We want to be comprehensive. We have a lot of diagnostics we do. We do more than I think most people would expect if they're going to get a ketamine treatment.
Sure.
So
it feels like a traditional medical experience for most people.
Yeah, it is. They go in there, they pay their copay, and they see the physician.
Right.
However, just we want to make sure our facilities are perfectly arranged for a good setting for them, and then we want to ensure that the staff that's treating them is all specialized, and we want to make sure we give them a bunch of options to choose from that would fit them individually. We'll do genetic testing, we'll measure cognition pre and post ketamine. We do that a little bit more. So I think when somebody comes into our clinic, we just know that we don't have to send them out to a fragmented system. They can kind of sit in one ecosphere. I know Daniel was up on stage just recently with Mike Tyson talking a lot about Wesana and our side about focusing on traumatic brain injury, and that's one of the wings of Wesana that we're known for. I'm really focusing a lot right now on trying to get the clinic side really focused in its own way, because we will be adding those treatments he's talking about for TBI into our clinical structure as we build evidence for it.
Could you give a nutshell explanation of the parallels between traumatic brain injury and addiction?
Yeah, well, they actually are very comorbid, meaning that the presence of traumatic brain injury, like you have a much higher chance of actually having an addiction. And a lot to do is it's the concept of just trying to numb the symptomology, which looks actually a lot like a psychiatric diagnosis. So post-traumatic stress disorder, getting agitated easily. There are a lot of like psychiatric symptoms in TBI. So, depression, anxiety, mood swings. Then there's a lot of physical symptoms as well in TBI that might be, it makes it its own unique condition. However, the treatments overlap. Like right now, if somebody goes to get traumatic brain injury treatment, they're pretty much kind of just going in the traditional, route of being treated by a psychiatrist or a psychologist, maybe some imaging, and it's all fragmented.
Yeah.
So our goal is to track patient outcomes. So we do a lot of that. So if they come in, we have a solution, we call it Wesana Solutions. It's like a remote patient monitoring device. So meaning like your Apple Watch or Fitbit, Garmin, and it's measuring your heart rate, measuring we can tell if you're having a panic attack, are you getting lethargic and staying in your bed and not leaving, are you not sleeping enough? All that data gets pushed to the clinician in a dashboard and is designed for ketamine and psychedelics. So we're building protocols based off that. We know what's happening now with our patients when they leave our clinic. And then all that data is going to help us try to further the evidence and the clinical protocols. So we really want to make sure we're helping advance the science behind what we're doing and try to get the best practices.
And that you think that's unique to Wesana's goal, is integrating the scientific technologies to be able
there's a lot of focus, I would say, on integrating data and trying to further the evidence. There's a lot out there. I think what makes Wesana's unique is that we're one of the only that we're measuring rating scales, what we call we give you a survey of 9 questions and we rank your score of depression. That's common, but not too many, I haven't seen anybody else really putting that with all the passive biometric data and then putting that in a model of giving ketamine or psychedelics where its traditional psychiatry base is also available as well. So a lot of the companies out there might be focused purely on ketamine, right? Whereas we're going to focus on ketamine in the ecosphere of a mental health clinic.
And that takes everybody at the company being on the same page with regards to the entire universe of what's possible in psychedelics.
Oh yeah, there's a lot. It's hard. We got to stay focused. Opportunities galore coming, and we want to do so much. So I think that's something we're working on right now, is really gonna say what's our exact mission and how are we going to present this? Because there's drug development or care development side of Wesana, we going through the FDA with Sana compound, which is psilocybin and CBD. But we're in care delivery now on this side here as well now, right? With our new division in Wasana. Since they acquired Psychiatric, we're providing the remote patient monitoring and all the clinical solutions into that infrastructure. So it's a shift. It's a shift so that we're going to focus on care delivery now and help people now. But then at the same time, we're also developing psychedelic medicine at the same time. So I think it's a good complement. 5 years from now, that's when it really all starts coming together in a good way. Because right now, they're 2 different processes, care delivery.
As a practitioner, when you look at the world of people who have access to the treatments, and economically speaking, will people at a low income to poverty level of existence in America have access to these sorts of therapies?
So I don't think that's going to happen right away, but I think there's a lot of awareness that if this is not prioritized, the natural route could just be that it's hard to obtain and it's kind of exclusive, it's expensive.
If it's not prioritized at a legislative level?
In multiple levels, right? Legislative, even from an entrepreneurial level, entrepreneurs sometimes might need to come in with a different angle to ensure access to care. So on our side, like when we're doing, we're making clinics nationally, right? We're acquiring and we're building. But we are also open to looking at certain types of acquisitions where they do take Medicaid, let's say, and they may serve an indigenous population in a way for us to figure out how to improve access to care for them in psychedelic space. Like one of our goals is to get insurance companies to remunerate for all these therapies. And if they do that, Medicaid and will eventually be reimbursing, and Medicaid is the primary payer for someone struggling financially, and being able to help that cause is one of our goals here. So It's really about trying to improve access to care in any way we can, and that goes through the mainstream system of insurance companies, FDA, the medical boards, all of that.
Your estimation right now as to where the industry stands and where it could be headed, are we really at a point of breakthrough possibilities here? Do you really think this is going to happen on a much grander scale and a lot faster, shorter time frame than maybe we expected 10 to 15 years ago?
I definitely think so. You can't ignore, if people that have been advocating for psychedelic medicines, when you ask them how it felt 5 years ago, it's just a whole different thing. Just the acceptance is, even outside of this ecosphere of being in this conference where everybody here is really interested in the space, when I go back out to the just medical community at large, let's say, now 5 years ago, everybody's like, what are you doing? Like, wait, what? A ketamine clinic? They didn't even understand.
And you were working with ketamine clinics 5 years ago.
I opened the first one in Chicago. There was no psychiatrists doing this. They all thought, I don't know about this. That's kind of the old naive, hey, isn't that addictive? What do you, that's not FDA approved. I'm like, I'm an addiction psychiatrist. Don't worry, this helps addiction. And the way you're practicing psychiatry might be different in 5-10 years. But now, that it's a different conversation. They're like, I've heard about what you're doing. I've heard about the space. I've read the new studies coming out. So because there's so many studies coming out, there's this swell of acceptance and people coming. That to me we're at the turning point. I think it's 5 years from now, everything's going to be different in how we're operating within the medical paradigm.
I won't take too much more of your time, but if you could pinpoint perhaps when you saw the light that ketamine really was a very advantageous treatment methodology for you to fully invest in.
So following the data for a while, back in 2012, and then Dr. Zarate at the National Institute of Mental Health, his study was landmark because he kind of framed how do you give ketamine in an actual logistical manner outpatient, right? And that protocol is what kind of started it. But now I have a protocol I could follow. So when I opened the practice, I had never actually treated a patient with ketamine, but I opened the practice because I wanted to make a ketamine psychiatry clinic. I just knew the data was so good I had to try offering this because there's an epidemic of suicide that we don't have good treatments for. First patient though, done deal. First patient, was kind of miraculous. I mean, it's kind of miraculous when a family member tells you they're coming back to two sessions later crying, the mother saying, I have my daughter back. It was just wow, nothing that we were using before was coming close to this. It took forever to kick in, not successful all the time. And then we see 70-80% success rates with ketamine, and it's dramatic. So anybody who comes into that world and from the medical side and treats a patient, it's always the same story. They're like, we're all in now.
I love it. I love to hear that. Thanks for your work.
Thank you for
stay diligent.
I appreciate you having me on.
It's got to be so gratifying to be able to get such tremendous results and to see such sweeping changes.
Yeah, it's an exciting time. Thank you for having me. It's a great opportunity.
Yeah, we'll talk again.
Thank you.